Hello, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm Sherry Binns, the Patient Healthcare Liaison for the Foundation, and tonight I'm being joined by Emily and Andrea Blasberg from Mr. Oscar Monkey, a pediatric MS organization. Emily is an MS patient and founder of Mr. Oscar Monkey, a pediatric MS organization formed with the vision to help reduce the life-changing realities of pediatric multiple sclerosis. They provide age-appropriate resources, advocacy, and community. Emily was diagnosed with MS when she was 15. Though her symptoms started at a much younger age, she's well aware of the challenges that MS presents to someone so young, and has committed herself to her advocacy for pediatric MS, finding ways for kids and teens to connect and network across the United States and the world, and supporting the pediatric MS community so that no one has to feel the loneliness she felt. Andrea, Emily's mom, is no stranger to the MS world. Her husband, Dean, was diagnosed with MS in 1998, and Emily was then diagnosed 13 years later. Andrea has been a caregiver for not only one, but two family members living with MS. Through Mr. Oscar Monkey, Andrea shares advice for other parents. She assists in facilitating education and community building programs, and she helps with the day-to-day operations of the organization. Andrea has a unique perspective being a caregiver to an adult MS patient as well as a pediatric MS patient. She attends every appointment with Dean and Emily to stay informed and assure that she's providing the best support possible. I'm going to ask you some questions. Is there anything in the bio that you want to flesh out or add to it?
I think really it's not even in our bio, but just another piece that we're in the middle of right now is that I'm getting married in 2 weeks. And so my mom has also been, my right-hand lady for getting everything ready for the wedding. So we're very happy to be able to join tonight and find ways to help kids at their appointments and not have it as scary.
Oh, you run a camp every year. Wisconsin, is it?
Yeah, so one of our camps is in Wisconsin, the other one is in Minnesota. Our teen camp is for teenagers ages 13 through high school graduation, though we've also expanded into young adults. That's in July in River Falls, Wisconsin. And we draw from all across the United States. We even had one from Canada and one from Iceland this year. And our family camp, we actually just posted registration last week. Our family camp is in February in Minnesota. One of the favorite activities is sledding. So it's very fitting that we would have it in the winter.
Well, then you don't have to worry about heat intolerance either.
Exactly.
Right? Exactly. Andrea, you brought up a question that we wanted to talk about as a parent of a child with MS. How do you sort of explain to your child that they have a chronic illness, but it's not life-threatening and it's not life-ending?
I think a lot of it depends on the age of the child. We spent a lot of time through the years helping explain many things to our kids at the level that they could understand. When my husband Dean was diagnosed, our girls were very, very young. Emily was two, and her older sister was almost 5. And the way it was explained to them was that Daddy had ugly buglies in his brain. And then we had them go on the MS bike ride with us. And so their slogan was to stomp out the ugly buglies.
Okay.
as they pedaled, they were stamping out the ugly buglies. So, so much of it all along the way has been, what are the kids capable of understanding? They need something.
Yeah.
Because even the very little ones are aware that something's going on.
Right.
And so giving them enough information without scaring them is really important.
Now, you come from a unique perspective of having seen Dean go through the diagnostic process, and then Emily several years later. Did they present similarly? Did you
No,
even think that Emily might have MS based on what you'd seen with Dean?
no, especially initially, Emily's symptoms were far more severe and persistent. And no, it began to occur to us that we could be looking at MS.
Right around 10 months of
Yeah,
exploring.
well into her symptom management. It took 14 months to get her diagnosis, and at that time, then we were. It was more of a, well, it's about time.
Well, and also something to note is that because my parents had made MS such a familiar and comfortable thing in our lives, I watched my dad taking part in his life and not letting MS control everything he was doing. So when I was finally diagnosed, it was kind of like, okay, we know what we're dealing with now. It's not something that is brand new. We know nothing about it. It was in a way, it sounds weird to say this, but in a way, it was kind of a relief because it was something that we knew.
There are kids that we have met along the way who have first been diagnosed with a brain tumor.
Yep.
And so, at least we knew we weren't working with that. And
A lot of adults are too.
yes. And
It seems to be a very common first presentation often.
Sure.
So that's not all that different. Now, Andrea, how was Emily personality-wise? Was she kind of over-responding to some of her symptoms? Was she getting dramatic about them? And if so, how did you deal with that?
I made a deal with my kids when my oldest daughter started school, Emily's older sister, when she started probably first grade. We sat down and we said, there are days that you're just going to not want to do what you're supposed to do. You're not going to want to go to school. And, we all have those days where there's just something in us that just, we can't go face the world for whatever reason it may be. And so as a first grader, I gave my daughter one day during the school year where, don't tell me you're sick. Don't make up stories. Just tell me you need a day and I'll make it happen. And so with that understanding, we kind of created that respect in our kids, that if something was wrong, we could face it together. But if it wasn't really physical, something that was wrong, they just needed a break. That was, that was what we dealt with. So when Emily's symptoms started, I actually had that conversation again with her. Now at this point, she's 14. She knows the ropes. And I said, okay, I want you to be honest with me, because there were some days that I really wasn't quite sure. Because as many of you know, MS is just weird at times. And so she would come in with these weird symptoms, and I had to make sure, are you being honest with me? Because if you're honest with me and that's what's going on, we can deal with that. So it was a lot of conversation. It was a lot of making sure that I understand that some days you just are done. But let's just stay honest, stay on track, and we'll handle it.
And it was trusting each other.
Yes.
Not only you trusting me that I was telling the truth, but me trusting you that you were going to take me seriously.
Yeah. Yeah.
And I hated missing school too. Like I wouldn't just like, I don't want to go to school today. I don't, because, you know, I had homework to make up and I had tests that I had to make up, and
Yeah.
it's a lot more work just to miss school than it is to
Yeah,
come to
yeah.
school.
And that was back before our days of Zoom, when you could sort of be at home and kind of relax.
Yes, for
Um,
sure.
Did you have an MS specialist involved in her care at the beginning? Was there a pediatric MS specialist that you reached out to?
So when my symptoms first presented, my parents brought me to the emergency room and they brought in the pediatric neurologist that was on call that day. And he ended up being my neurologist for the next year. He ran, you know, every test under the book. He was monitoring me very closely. We did go to a different clinic just to see, you know, get a second opinion, see if they could find any answers for us. And that clinic had a pediatric MS specialist, but it was ultimately that first neurologist that diagnosed me. And then he sent me to an adult neurologist. I was 15 at the time, but he was able to talk this neurologist into taking me on as a patient as a 15-year-old. And I've been very grateful to continue that relationship with him. I've been with him for 11 years now.
Yeah.
And so, you know, establishing that relationship is really important.
And were you recommended to go on a disease modifying therapy right from the get-go? Or
I
are
was.
you on?
Yeah. And actually, my neurologist sat down with me and my parents, and he explained every single DMT that was on, or that was an option for me. He explained all the injectables, all the pills, all the infusions, everything that would be an option for me,
Mhm.
and said, I'm comfortable with you going on any of these ones. Let me know what you decide.
At that time, the oral medications were not yet available.
Right.
So he made a big promise to her. She was in 9th grade when her diagnosis finally came. And his big promise was that you will have an oral treatment before you graduate from high school.
And as we know, Gilenya was the first drug that was approved to treat pediatric MS, other than the injectables, the interferons. I've seen huge changes over the years in pediatric MS. Back when we first targeted MS in the pediatric community, there were no disease modifying therapies that were approved to treat it. And so it was kind of, we tried them on the drugs that we had available at the time that we knew were safe and had long-term safety in adults, and the kids managed them pretty well. So I'm wondering, Emily, how did you deal with injections?
I didn't like them. I never missed a dose. I was on injections for a year before I was able to switch on to an oral medication. And I learned to deal with it. But even things that the adults don't think about when they're on injectable medications is, if I'm going to a sleepover party, I have to bring it with me because I need to take my meds. And there were some times that I would hit a spot wrong and it would be really painful. And so it may prevent me from going to whatever activity I was planning on going to. I might be delayed a little while I hold an ice pack or a hot pack to the injection site. But then I would still go to those activities because having those activities was so important as well. Keeping the routine, keeping as normal as possible, and not, as I said before, not letting MS dictate what I can and can't do. And the injections is part of that as well.
Okay. What did you find? Did you end up having to have procedures for diagnosis that were scary for you? Or did you pretty much know what, based on what your dad had been through, what to expect? And if something scared you, how did you deal with that, Emily?
Definitely, there were some that were scary. I actually want to pull a story from someone else, one of the kids that we work with. Um, she was diagnosed as a child, and yeah, she was 11 when she was diagnosed, and she did not understand what an MRI was. Nobody explained it to her. And so, as she was sitting in the MRI machine, she was terrified. Not because of the noises or that she was in this very enclosed space, but because she thought that they could read her thoughts while she was in there. So she was terrified about, what am I thinking the wrong thing? You know, what I don't want them to know what I'm thinking. And so it if someone had explained to her, no, we're taking pictures of what your brain looks like. We're not looking at your thoughts. We're looking at your brain. That kind of clarity would have made things so much different for her.
Yeah.
Even just showing her pictures of MRIs.
Exactly. Yes. This is what we're going to do. You know, this is what we're going to find when we look in your brain.
Mm-hmm. And did you end up I'm sorry, go ahead, Andrea.
As a follow-up to that, we all, as much as we could, we try to, and still do, try to get copies of our imaging, whether it's the MRI or if the kids go to the emergency room for a broken bone, we ask for the copy of the scans. Now they're digital.
Mm-hmm.
So we get a disc and we have to find a really old computer to put them on. But it's a way also that we can sit down and have that discussion. And so from the time she was real little, with Dean's images that would come, you know, in the big films, we could bring those home and show the kids what was going on. And we talked so much about everything that we could, again, at an age level that they could understand.
They actually taught us so well how to identify the lesions in the MRI scan that when I brought home my scan right before I was diagnosed, I plugged it into my computer. I was looking through the scan and I go, there's another lesion. So my mom had to call the doctor and say, you need to get these images read because she already read them.
Little self-diagnosis there.
A little bit.
Did you end up having to have a lumbar puncture or a spinal tap to get your diagnosis too?
Yeah, I actually had two. I had my first one when my symptoms initially presented themselves, and that was really, really painful. And so when they said they wanted to do a second one right around the time of my diagnosis, I said to my doctor, you can do a second one, but I'm gonna be asleep.
Knock me out.
Just knock me out. And he did. He had no problem with that. And so that's something I would definitely recommend to kids or teenagers or anybody who, you know, is nervous about dealing with that pain, because it's a big needle.
It is.
And it's an unusual spot to get a needle.
Yeah.
And that's, you know, that's one of the things that we've encouraged Emily also at these appointments to really be her own advocate, because as painful as it is for a parent to watch, you know, the procedures going on, I want to know that my child is feeling okay about this. So for her to speak up and say, yep, this is what I need, I'm going to stick with her and say, yep, that's what she needs, because she knows what she needs.
Going back to that whole trusting each other thing.
Yep. And empowering your kid to really have a voice in the conversation.
Mm-hmm. Well, most spinal taps or lumbar punctures tend not to be that uncomfortable if they're well anesthetized, and so we hear stories all the time. I mean, I've had two myself, And the second one, I didn't have any anesthetic for it because I'm allergic to many of the local anesthetics. So that was good for me because I could actually guide him. I said, no, the needle's going down towards the table. It needs to go straight in, because I could feel enough of what was going on. It
Oh my goodness.
wasn't painful per se, but it was an uncomfortable, weird feeling.
Yeah.
So I think it really kind of helps when you know somebody's going to have a spinal tap or a lumbar puncture, that that you can explain to them exactly what's going to happen. Now, you had the benefit of knowing that your first one was not a good experience for you and used your voice. Um, I work with adults all the time on how to use their voice in healthcare visits, but I know that you guys have done some things with that, with symptom tracking and with going in prepared. So I do have the attachments that you sent to me. Would you like me to pop them up onto the screen?
Sure.
Or do you, is that, all right, let's see, where share screen. Host disabled participant screen sharing. Okay, Bobia, could you let me share my screen, please?
Yes, give me 1 second.
I can explain what these attachments are in the meantime. So we
Okay.
created a medical journal to be used as a tool for kids and teenagers to have that voice and to be an active participant in their healthcare team. So it's a resource for them to know all the information about their doctors and their medications and their appointments and tracking their symptoms. And if anybody has any questions on this journal or folder, feel free to reach out to us and we'll give you more information.
So can you see what I've got your symptom tracker up? Can you see that?
I don't see it.
No. Share.
There we go.
You got it?
It's coming.
Okay. When I had my screen up, I could scroll back and here we go.
There we go.
All right, so I'll let you explain it while it's up and you can tell me when to move to the next one.
Yeah, so this part here is tracking the symptoms. So this is a sample page that we have. We have another one that's empty. But this is, as it says, my right leg hurts. So there's a pain scale to explain through the Oscar images what is the pain that you're feeling and when did these symptoms start. Because often, I know for me anyway, I get to the doctor and they say, well, when did the symptoms start? And I go, I don't know, like 2 weeks ago maybe? And you will say, well, no, it's been 6 weeks.
And our appointments are 6 months apart. So there's a lot of time and a lot of possible symptoms that may pop up in that time. So keeping track of them is really a great idea.
And that's something that I tell the kids that we work with all the time. They'll text me or they'll call me and say, I've had this weird symptom going on. I said, did you write it down? Write it down right now, date it, and so the next time you go to your doctor, you're able to tell them this information. And if there's not an easy way to describe the symptom, do your best. Find a creative way to describe it. Write it down, just some notes for yourself so you know what to tell the doctor when you do see the doctor. Do you have any other notes on this page?
Emily used to have some real creative ways of expressing how her symptoms felt. And there were times when we would look at her, how did you come up with that? It might be, that feeling when you're sanding a board and that the sandpaper, not the board, and it's that sandpaper touching your fingertips. That's what I'm feeling.
Okay.
So I'd have to go get a piece of sandpaper and I'd have to feel that to know. But it was the way that she could express that, and oftentimes she could do that using things that we have in common, that I could figure out what was going on with her. So all of that is is a great resource if your kids can be creative and um, write these things down, because that was actually really easy for the doctor to understand then too.
Okay, so we go to the next page.
Sure.
Yeah. So this
Okay.
next page is as you are preparing for your appointment. So the appointment date is on there, the doctor that you're going to see, where the appointment is. It's something that's important for the kids to be aware of, so that, you know, if anybody asks you, where do you see your doctor, then they know that information. We purposefully sectioned this off in this order. So it was my questions, meaning the child, and then my caregiver's partner, my caregiver's questions, because we want my questions as a child to get answered first. That gives me the main voice in the appointment. It gives me the direction of the appointment. And then if I missed anything, or if mom or dad have other questions, they can answer their questions at that point. What we have found with some of the kids that we work with, when we show them this page, they say, well, my parents always have so many questions that I don't have any time to ask my questions. And so we really want to focus on, as I said, putting those kids' questions first. Later on in the page, after the questions, there's things to tell my doctor. So it might not be a question, but some of those symptoms that popped up. And so this isn't even a page that you fill out the night before your appointment. This is something that you keep track of those symptoms, and you really keep those notes handy at all times, so that you are prepared when you see your doctor, as you said, every 6 months or whatever your appointment might be. If there are new symptoms that come up, and then if the doctor has changed any of the medications that you might be taking, or if the doctor says any other things for you to be aware of, or instructions or anything. And that's all on this page. And then if you look to the next attachment, there's a blank version of this. So the two previous that we showed were samples. And so this is what the blank page looks like. This is what the kids receive in the book for them to fill out. And we also encourage the kids to be the ones to fill this out. Mom and dad can help. They can sit next to them at the kitchen counter, and
we encourage mom and dad to do that.
Oh, definitely.
Be a part of that.
But it's all about empowering the kids to have the loudest voice and to be a huge active role in their healthcare team.
So many of our kids are diagnosed, in their young teens, and it really doesn't take long for them to turn 18, and it's rather startling. As a parent of a kid who turned 18,
26.
Yeah, she's older than that now. She's really old. But the 6 days after she turned 18, she called me from camp and asked if I would reorder her medication for her. And I couldn't do it. 6 days into her 18th year, they wouldn't talk to me anymore. So it's just really important, again, to understand that whether you think they're ready to go or not, the medical
HIPAA
world
insists they are.
Yep,
Yeah.
exactly. And the more you can prepare them for that day, and Emily was very prepared. It was just I wasn't. So
Now,
Well,
I'm going to ask you about this book in a minute,
Yeah.
but let's take a look at the next page. Oh, that's your blank symptom tracker,
yeah.
right? This is all part of a book that Mr. Oscar Monkey has available to people. Tell us about that, please.
Yeah, so we have it as a printed version currently, and we do sell them, and we send them to those who request them. We're going to be talking to our board soon about if we want to make it a digital version or not. So that's to be determined. We like having the hard copy because it's something that is tangible. It's something that you do sit down at the kitchen counter and you page through it and you physically see what you're looking at, and it's not another app on your phone that can just, get lost.
It's also much easier to share with your medical providers. If I can take a piece of paper with me, and rather than holding up my phone to show the doctor, um, we we just like the idea of the engagement that can happen between a parent and a child, or a parent and a teenager, when they're sitting down, heads over the book, taking a look at what they can learn and do together. And it's it's the kids making sure that they know who are their caregivers, who are their resources. So you might put the neurologist on there, but you might also put the next door neighbor, because that next door neighbor is the one who can pick you up from school if mom and dad aren't available. So making sure that you have that the child or teenager has that contact information for that. So
And we often find that the kids want to know this information.
Yes.
We gave this folder to all of our campers at summer camp this summer, and one of our parents reached out to us and said, when my kid got home from camp, she didn't just put this folder away. She's like, no, I need both mom and dad to sit down with me, and we need to go through this book together, because I want to know this information. You have the information, but I want to know it. And so she actually like completely took charge. It's like, nope, we're gonna fill this out together, because I need to know this stuff.
now she's 15. So, and she also is now independently working towards making her own doctor's appointments. So, and the way we suggest doing that is mom or dad sit down next to them when they get on the phone, and even give them the words. This is so and so, and I'd like to make an appointment, and this is who I need to see, and this is why. And it's giving them the words that they need, giving them the opportunity, and trusting that you're right there if a problem comes up, but knowing that they're fully capable of doing this.
And it's helpful to know how to do this stuff before you have to.
Right.
Earlier we talked about the 18 years old, and all of a sudden you have to do everything on your own. So practicing it before you get to that point takes a lot of nerves away too, and a lot of the scariness of the transition.
Mhm. Now your website, MrOscarMonkey.org. Okay, so for anybody that's watching this live, this will also be up on the foundation's YouTube channel in about a week, but it will be on Facebook Live for at least the next week or more. If you're needing to connect with this organization, it's MrOscarMonkey.org, and there are links at the top of the page for the resources. Just go in and find out what's there. Oh, we got the pup.
Sorry.
Hide it. No, that's okay. No. Bobby is dealing with the same thing with her dog behind the scenes, the joys of Zooming here.
It's dinner time for them.
So you can find out when you go to that web page, not only the resources we've been talking about and things about camp, but you can also find stories from the kids. And I encourage you to just go and spend some time with that site. We're about halfway through. I want to leave time for questions and answers, but I just want to just see if there's anything in your list here. I think we've pretty much covered the list of things that you sent to me that you wanted to cover. Is there anything that you'd like to flesh out and add to that?
I think one thing I'd like to add, we talked about explaining all of the tests and procedures, but also there are some that you can even practice at home.
Mhm.
One of the things that we practiced was actually the neuro exam. Why is the doctor making me touch my nose? And so really becoming familiar with what the neuro exam is and what they're looking for. And then that's also helpful for mom and dad at home to know, okay, I'm feeling that you have weakness in your right hand.
Mhm.
So seeing what the doctor is doing and then practicing that at home,
Yeah.
and it can help as a tool to also tell the doctor what might be going on. We also talked about building that relationship with the doctor, and explain how you taught us how to have a relationship with our doctors as a kids.
I don't remember.
Okay, so when I was a kid, you would we went to the pediatrician, and you'd say, Emily, the doctor would say to my mom, what are her symptoms? And she would look at me and say, tell her about the pain you've been feeling in your ear. So not necessarily answering the question directly, but kind of feeding me what to answer. And so that also, from, as I said, pediatrician, gave me the comfort and the familiarity of talking with my doctor. But then also something that we always have continued to do with our doctors is tell them about things that are going on in your life. Don't have it all just be completely medical, because then your doctor is just medical. If when you have this relationship with your doctors, you want it to be a relationship, because then you have that comfort and it's not as scary. It's someone that's familiar. It's someone that's friendly. This is all about things not being scary. And so when you have those conversations about just, I won my soccer game on Tuesday, then it's more like telling a friend what's going on.
And I will say, with that in mind, both Emily's pediatrician and her neurologist were invited to the wedding.
Yep.
So,
because we have that relationship.
yeah, and that is something that we have cultivated. And Emily's neurologist is also her dad's neurologist, and so we call it their weird every 6-month father-daughter date. They go visit the neurologist. So yes, it's just we have always tried to give them that voice for sure. And I know we keep coming back to that, but making sure that the kids know that their voice in their own health is
the loudest voice.
Emily, when you started dating, how did MS come into the relationship? Did you introduce it right off the bat, or tell us how you dealt with it?
When I first started dating, so I had already had MS before I had started dating. And yeah, I was very open. During any of my relationships, I would tell them, I might have to not go on a date tonight because my fatigue after school is just way too much, and I'm sorry, I don't have any more energy left. And so they would either be totally fine with that, or they'd say, okay, well, I'll come over and we'll watch a movie on the couch. I'm like, perfect, that's great.
She was home from prom at 9 p.m.
Yeah,
but he came and they watched a movie, and it was great. He was wonderful,
and we still had all the prom fun.
Yeah,
I know that's something that we'll probably address around prom season. But yeah, it was just being flexible and also having a flexible relationship.
Yes.
Now that my fiance, my introduction with Zach was, I run this nonprofit organization for pediatric MS. So it was kind of like, you really can't hide that I have MS.
Does he come with you to your doctor's appointments now?
He does. Yeah. So we started dating during the pandemic. And so he attended my dad and I, our neurology appointments with us on the computer. But then now he attends with us in person. And we also, of course, just like my mom, he is there to be an extra ear and to provide support and to learn from the appointments. But then also, if he has any questions, then we give him the opportunity to ask those questions as well.
And I think this is it's probably unusual. And there are going to be families out there listening to this who say, well, my child with MS is 22, and they've been going to their own doctor's appointments for a couple of years now, and for our family, we have found that that extra set of ears is really helpful. I'm not there to direct Emily's care. I'm not there to make any decisions for her. I'm just there to help be a sounding board, knowing that I have the same information that she has. So it's it's a level of trust that she and I have developed, that I'm not going to take over her doctor's appointment. But it's a definitely a great tool that you can use if your family structure will allow that. And if not a family member, perhaps you have a trusted friend that can attend if there's a young adult in your life that really could use an extra set of ears along.
Good. I just want to let people know that are watching, if you have questions for Emily or Andrea, you can tip them into the chat or the Q&A at the bottom of the screen. If you just hover your mouse over the bottom center of your screen, it should pop up little icons that you can type in questions, and we'll try to answer them for you. Bhavya, if you could watch the Facebook live stream and anything that comes in on that, if you could just type it into the chat so we can get them to answer that, I'd appreciate it. Facebook live stream is not working this time. Oh dear.
Oh.
Okay. Well, look for this then on our YouTube channel, the Multiple Sclerosis Foundation YouTube channel, in a week or two, and it will be up there. It will also be posted on the Multiple Sclerosis Foundation Facebook page, the public Facebook page. I just want to let you all know that we at the Multiple Sclerosis Foundation have some private Facebook pages so that people with MS or their caregivers, care partners, can speak sort of with the community without others watching or listening to their conversations. So the Multiple Sclerosis Foundation private Facebook page and MS Focus Confidential for individuals living with MS only. No significant others, caregivers, anything like that allowed on that page. And then we have an MS Care Partners only page that's a private Facebook page. So those of you that are listening, if you'd like something, people are screened. You have to answer a set of membership questions in order to get in. So we do our best to kind of protect your privacy where that's concerned. We also have a number of support groups across the country, right around 170 that we're sponsoring, that we are providing information for. So if you're looking for that sort of thing, certainly respond to the email you got to register for this program, and we can hook you up with Marcia, who is our support group person, support groups at msfocus.org. We do have one booklet on our web page, msfocus.org, and it's called Monkey Snot. And you've read Monkey Snot?
Yeah, yes.
And it's basically a cartoonish type of book that explains to kids what MS is, and if they've got a parent or a sibling or an aunt or an uncle or a grandparent with MS, it talks about some of the symptoms that people with MS might experience and how that might look to the child as they're learning to live with MS in that relationship. Those books are free of charge. You can just request at support@msfocus.org, and we will mail it to you. They're also in our publications section on our webpage, and you can view them digitally. So that is available. I don't see any questions coming into either the chat or the Q&A. So I will let you, if there's something else that you want to talk about, we still have 10 or 15 minutes. So please feel free to add anything that you feel might highlight what you've been talking about.
Well, I can tell you a little bit about one of the first goals that Emily had when she was diagnosed was to connect with other kids her age. She was looking for teenagers in our area, and again with HIPAA, it's kind of hard. Even though the doctors knew there were kids in the area, they couldn't tell us anything about them. And so she turned to Facebook and tried to reach out that way. And eventually she came around to meeting some people. It took a very long time, over a year. But in that time, she started to create some buddies. I'm trying to, if you go to our Facebook page, which is Oscar the MS Monkey on Facebook, you'll see pictures if you go to the photos or go to the guest posts. There's Oscar. This is Oscar, and he is our CEO. He is a monkey that Emily created for herself, and other people decided they wanted Oscar also to come live with them because the stories that he was telling on his Facebook page and the adventures he was going on sounded really interesting. And so what we ended up doing was creating little buddies. They're little orange monkeys. They're a little bit smaller than him. And we send them out to whoever needs a friend. We don't charge for that. We don't want anyone to pay to have a friend. We'll happily accept donations because we do need to keep the program rolling. But these buddies have now been sent to over 7 countries.
Yeah, we've sent out almost 600 of them.
600.
And they're all handmade.
So each one is unique. Each one is very different from another, and they have a lot of personality.
And I will note that our inventory at this moment is empty. So if people are requesting a monkey, it may take a little while to get the inventory built up again.
Again, back to the wedding in 2 weeks.
Yeah. Kind of.
So they're all handmade. Who makes them?
The 2 of us.
Okay.
Yep. So if anybody has any like TV show suggestions on Netflix or Hulu, that's what we usually turn on the TV and have a monkey day. We'll just sit and watch a few episodes of a show and just be sewing the entire time.
Okay.
Yeah, so the monkeys were the original way of connecting. So the kids could see their monkeys on the Facebook page, and they could see that other kids were posting them. And we've had kids of almost every age have a request of monkeys. I think the oldest was 80 something that needed a buddy. So,
but the buddies also serve as a tool for the kids, not only for a tool for connecting with other kids and seeing the connection of having other kids with MS, but also a lot of our kids use their buddy to describe their symptoms. Yeah. Tying back to going to doctor appointments. My buddy, I'm talking to my doctor right now. My buddy's right arm has been really tingly, and so I've been doing what I can to help him. I put his arm in a sling and to see if that helped. Or my buddy's head has been hurting, or my buddy has just been really tired. Putting the pressure on the buddy, all of these weird symptoms that are going on, putting the pressure on the buddy so that it's less pressure on the child himself. I know one of our kids brought the buddy to his parent and said, I can't go to school today because my buddy's head is just hurting so bad. I need to take care of it. So that was their way of saying, my head really hurts.
Yeah.
I can't go to school today. But then they didn't have the pressure of feeling like, oh, well, I'm deciding that I'm not going to school. I need to take care of my buddy instead.
Our buddies are also MRI friendly.
Mhm.
So we have had them, we have pictures of kids going into the MRI with their buddy
With their
right
buddy.
next to them. So it's been another way to make appointments less scary, is that these kids know that they're connected and that other kids have been where they are, and so they're gonna be just okay.
So do you accept donations of fiberfill and fabric and things like that?
For fiberfill, we do.
Yes.
We use a specific sock because they are made out of socks. We use a specific sock that we actually dye to the colors that we want them to be.
Yeah.
But if you're interested in any donations of any kind, again, please send us an email and we'll let you know what we could use.
Yeah.
And that's info@mroscarmonkey.org.
Oscar at mroscarmonkey.org.
Oscar at mroscarmonkey.org. Okay, all right. Still nothing coming into the chat. I loved getting to meet him and learn how the kids are using them. It's a great job. Did you make masks for them during the pandemic?
We did actually, yes. He went with me to get my COVID vaccine and my booster, and he was masked the entire time.
Yeah.
I actually have a picture of him on Facebook getting his vaccine as well, so he is vaccinated.
Yay.
We had teen camp in 2021, and we weren't sure if we were going to be able to host it or not. We ended up following CDC guidelines, and
all of our campers were masked.
And Oscar was masked. And as it turned out, when we got to camp, all of the campers had been vaccinated, as well as all of our staff. So we were able
Perfect.
to relax a little bit when we were just together in our dormitory.
But during our camp programs, we definitely keep health at the top of our minds, and like knowing that we are working with kids, that health is
paramount,
something to really be focused on. So if that means that we have to cancel programs, then that's what we do, because we want to keep our kids healthy.
We follow not only the CDC guidelines, but the American Camp Association guidelines. They have some wonderful guidelines to help us be able to run a safe and healthy camp. And
we had camp in 2022 as well.
We did.
And it went great.
I think I put out my feelers to find you your camp nurse for that one.
That was wonderful.
Yeah, it's just been really fun to get to know the teenagers and to tap into their experiences to allow us to be able to speak on their behalf here too. So.
The pediatric MS center at Stony Brook was running a summer camp on a regular basis. I don't know if they're still doing it, but it's only like 8 or 10 miles from my house.
Oh, really?
where they meet. So are you in touch with any other groups that you know have these resources for kids that have MS?
So I actually attended that camp through Stony Brook. I attended for 2 years as a camper and 3 years as a mentor, which means that I attended camp and then I was basically a camp counselor. I loved the camp. It was actually the reason why Oscar created a teen camp, was because we wanted to provide that camp in an additional way. Last I heard, Stony Brook is not doing a camp currently. They kind of took a pause during the pandemic. I haven't heard if they're going to pick it up again next summer or what have you. But I'll definitely be keeping an eye on that. I'll definitely be keeping that conversation open. Otherwise, I know that there is a clinic down in Alabama that has an MS camp for their own patients. So you have to be a patient of this doctor in order to attend this camp. I believe that there's
Canada. I know there's something.
Canada has
Toronto.
had a camp. I just got notification of a camp in Romania. So whenever we hear about other camps, we post information about those camps so that people get all the resources that they can and have all those different avenues of connecting with other people, because connection is so critical
So
for
It
living
is.
with MS.
Thank you. Our next webinar, we do generally a webinar a week for the foundation. Our next webinar, however, is going to be on November 8th, which is a Tuesday. Dr. Ben Thrower will be taking your questions. It's our Ask the MS Expert series. So we invite you to join us for that. And when you log off the webinar, when the webinar ends, a survey will pop up on your screen. We ask that you take just a moment to quickly fill that out. It helps us to know that what programs we need to be putting on for you. What is it that you need to hear from us? So feel free to stay on the line and do that survey. And thank you, Emily and Andrea. We so appreciate you taking the time. And again, it's Mr. Oscar msmonkey.org. Is that it, Mr.? Tell me.
MrOscarMonkey.org.
MrOscarMonkey.org. Okay, go to their website, find out about them, support them in whatever way you can. And thank you very much. Good luck with the wedding.
Thank you so much.
Thank you.